Hey there, Year 10 health students. Really hope that you're going well and that by the time you're watching this, or maybe there's no need to watch it, we might even be back at school in person, but we're just waiting for um, the ministers to have their meetings with the chief health officers to try and work out whether it is safe to go all the way back into the community and the way that we were living. Just with a few of these cases that they're still unable to track exactly where it started or what the missing link is between this group of people having COVID-19 and another group of people having COVID-19. We know that it is transferable, obviously, from person to person, and the current strain just seems so intense in regards to people not even being that close together and being able to transmit the disease so quickly. So hopefully, sit tight and we'll be back at school ASAP. But you might know more than I do when you are watching this video. So I just wanted to spend a little bit of time talking about where we've been, where we're going today, and then what's happening in the upcoming short period of time. So obviously we are currently in week 7 of this term. It is a 10-week term. So we have 3 weeks remaining. Now in the last week of term, you start your new classes usually, but you are meant to be on camp. So we are very understanding that we've essentially got 2 weeks left after this week. During week 9, it'll be all about your exam. We won't have any classes and you will have that, which means we only have classes left in week 8 and the exam period is beginning on that Thursday, Friday. So we've only got a couple of classes left together, which for some of you is going to be pretty exciting. And for others, you're going to miss this class and this subject. And I know that I've really enjoyed teaching my class and in communication with Mr. Tyler. He's really enjoyed teaching Year 10 Health and teaching his class as well. So thank you to each of you who have been great and active contributors to the lessons that we've had with discussions and completing all your work. It just means a lot to us that you work as hard as we do at times, because we put in a fair bit of effort preparing these resources, talking about differentiating our learning for you and all of that. So, where have we been? During this remote learning, once we had finished all of the content, I gave you in lesson 1 of remote learning a full recap of everything from weeks 1 through to about week 5.5 or week 6, and all the content that we'd been through about promotion of health and well-being within that youth category. Mr. Tyler planned a lesson for you during the second lesson of this week, which was all about how do I break down data and use graphs and tables in questions. And then obviously you have been working through some practice questions to prepare yourself for the SAC, which will be taking place next week during week 8. And we can do that SAC both online in remote learning and at school in person. So either way, be ready for it because the SAC is coming. Now, we're available on Zoom for you to ask us any questions, show your work to us, clarify anything, but feel free to also email your work to us as well. What are we doing today? Today you'll have 2 different videos. You'll have one video from Mr. Tyler. He is going to be breaking down what is a really good example of an answer to a question on a SAC to give us marks. Because remember, this SAC that's coming up, each of the questions is worth marks. So what we've been doing so far is allocating marks based on the rubric. We're jumping straight into the fact that you're going to have a question that's worth 3 marks and another question that's worth 4 marks. So Mr. Tyler's video is going to be invaluable to you about how do I actually write short, sharp sentences and earn marks to these questions. What I'm going to do is I'm going to go through the last 2 PowerPoints, of which there's a bit of language in there that neither of us have managed to teach to you because of time in and out of the classroom, etc. One of them's a little longer than the other, and one of them is relatively short, and you'll need to take some notes if you don't already have those notes taken down, because I know that we have asked you to go through these PowerPoints. So some of you, this will just be confirming understanding. Others need to hear it rather than read it. So here we go. I'm going to start with this PowerPoint here. And this PowerPoint, I want you to think about different countries around the world. Okay, I want you to think about countries that have really good healthcare. I want you to think about countries that don't have great healthcare. I want you to think about countries that have poverty and countries that are quite well off in terms of socioeconomic status. I want you to think about countries that have similar diseases and disease numbers. I want you to think about countries that have really high mortality rates and really low mortality rates. You're actually going to need to cast your mind back a little bit to term one, where we were talking about the different health status indicators and use words like mortality, morbidity, YLL for years of life lost, or YLD, years of life lost due to disability. So we really have to start thinking about that language again, because we're getting close to an exam where we're going to be asked those things. So there are a range of different factors that we talk about when we talk about the similarities and differences in health and morbidity and disease and mortality and death in different countries. And this is a list of some of the ones that we wanted to discuss with you. So I'm going to go through each slide, and each slide will break down that list into a little bit more detail, and you should create a few little dot point notes regarding each of these factors. Essentially, countries that have similar factors will have similar health status reports on each of those health status indicators. And it can lead to a burden of disease, likelihood of disease happening. So, first one, access to safe water. Now, we're talking about clean water from taps, running taps, etc. We're also talking about bottled water and being able to purchase bottled water for drinking. Some of you who have been fortunate enough to travel in the past and have been to different countries, you might have heard of something called like barley belly, for example, which is essentially referring to the fact that if you brush your teeth or if you drink the water from the taps in the country Bali, then you are likely to feel unwell. Now, this is not just a myth, this is actually truth. And basically, it's referring to the fact that the water that is coming through is not cleaned and sanitized as well as the water that comes through the taps in say, for example, Australia or America. Now, we don't just think of that in terms of drinking, but we actually need to think about it as food preparation and cooking. So if you're making pasta and you're getting the water from the tap, putting it into a pot and boiling it up so that you can place the pasta in that. Now, unless that water boils out any of the impurities and you put the pasta in there, that pasta can become contaminated. Washing and hygiene. What about having a shower and brushing your teeth, for example? Agriculture and production. You are watering the plants that are going to grow the fruit and vegetables that you want to eat with that same unsafe water. So what we see here is that people in low and middle income countries are at greater risk of the effects of unsafe water. And you can get a lot of diseases, gastroenteritis, diarrhea, etc., from waterborne diseases there. So that's one thing to consider as a factor. Now, the next one is about sanitation. Sanitation refers to the safe disposal of human waste. So that's urine and feces. Now, if we are able to have a toilet and plumbing system like we're lucky enough to have in Australia, where once you've finished and you flush, it all goes through the pipes and the sewage tunnels, and what happens is it gets treated at a treatment facility so that once that water is then distributed back out into the ocean, for example, it is not harmful. It's not harmful for you, and it's not harmful for the plant, the animals out in the ocean, etc. And so it's about the hygienic removal of the contaminants of those waste products. And countries that have inadequate sanitation clearly means that if people go swimming in the ocean, for example, look at India and the Ganges, it's very high risk of infectious disease taking place. Therefore, the disability adjusted life years is one of those health status indicators would show a difference for countries that have poor sanitation. Now, the next one is about poverty, and I really like looking at the diagram when discussing poverty. Poverty is about being deprived of something, and it's often due to income. So having low income means that you probably have poor living conditions. If you're living in poor conditions, meaning maybe no electricity, no running water, no heating, you're going to lead to poor health and well-being. And remember, when we mention health and well-being, we're referring to all 5 dimensions: physical, social, mental, emotional, and spiritual. Usually, poverty and low income also leads to a lack of education, or you can actually start at lack of education, which leads to inability to secure meaningful employment and therefore low income. But you can start anywhere around this ring. So if you just had poor living conditions, then you end up with poor health and well-being and a lack of education and an inability to secure employment, which means low income, which is why you have poor living conditions. So poverty is really about this cycle that occurs that's really, really hard to break for people, and it can actually lead to things like social exclusion, depression, and when people aren't educated, they make poor choices with their nutrition and their health, and their consumption of drugs, alcohol, and tobacco. Now, inequality and discrimination. We spent a fair bit of time talking about inequality and discrimination as its own standalone topic. But what we need to understand here is that some countries have higher rates of discrimination than others, and in those countries there are higher rates of depression, anxiety, premature death, etc. Now, we also need to think about the fact that some countries have tried to do the right thing. For example, Australia have implemented laws about the legality of discrimination. But it still does exist. You would have to say, though, that by having it as an illegal action, the data will show that it happens less often, and therefore it will have less impact on those factors that I mentioned earlier about depression, anxiety, and potentially self-harm or suicide. Now, this next one and that picture I find very confronting, but it's so true around the world in some countries. We talk about distribution of food and also tobacco and alcohol. So we're very fortunate about having the laws that we have here in Australia about tobacco consumption, including the tobacco tax, making cigarettes very expensive, so hard to access for some people, but also the fact that it is illegal to smoke underage or purchase cigarettes underage, and also how there's so many places now that do not allow smoking in or near their venues. So all of those laws and rules make it that it's a much harder thing to be able to complete as the action of smoking, which also means that there is a decreased amount of all the issues that are associated, the cancers, the cardiovascular diseases, etc. There are some countries, however, where it's not a legal issue and there is no tobacco tax, so therefore it is quite cheap. So even in low-income countries, it's very affordable to smoke, and when people get addicted to tobacco, tobacco companies are happy and they make their money, but it is being detrimental to their health. So what we've started noticing is that tobacco manufacturers will target those low to middle income countries, and also about the laws and the taxes and the regulations in different countries. They might even be non-existent in some low and middle income countries. So we need to understand how that impacts differences around the world. Now, alcohol, some countries around the world don't have or don't have a legal drinking age, but a lot of countries do. And look, for example, about the difference between Australia and America. So in Australia, the legal drinking age is the age of 18, but in America, it's the age of 21. So even in countries that have similar socioeconomic status, their laws and rules can govern a difference in alcohol consumption. But we also talk about different countries having a culture of consumption of alcohol, and other countries will have a feeling that alcohol is a negative thing and that it will not be consumed and that it is almost considered an illicit drug. Finally, we talk about processed foods, so the foods that last a long time in our fridge and freezer. They've got a lot of elements in their food to try and make them last longer, the processing of them. And what we understand here is that those foods are really marketed to low and middle income countries because they can be produced in such high numbers and are very cheap, but they are also quite unhealthy and can lead to things like obesity, hypertension, cardiovascular disease. So with that being said, that PowerPoint was all about different countries around the world and the similarities and differences in health across those countries. And I really want you to think about youth and that 12 to 18 year category. So the things like the alcohol and the tobacco, and if the legal drinking age or smoking age, or if there is no legal drinking age or smoking age, how can that affect that formative years of 12 to 18 where the brain is still making connections? And we know what alcohol and tobacco and nicotine and all of the tar and the elements inside that cigarette can do to the brain, because that's what we've studied and looked at. So I'm just going to open up the second one, and this is quite a short and quick one. 3 concepts here, and this is just talking about what are the costs that are associated, and it mentions mental disorders, but a lot of diseases, both physical and mental and emotional. So there's 3 different categories. There's the direct costs, and as that breaks down, the individual themselves will have certain direct costs, but the community will have certain direct costs. And then we have things called indirect costs, and they are broken into the individual and community's costs. And then we have what we call intangible costs, which is the hardest one to define. So the direct costs, these are pretty simple and straightforward. They are any cost associated with preventing the disease or condition. Okay, so if somebody has cut themselves on a nail, and they need to go to the doctors so they can have an injection to ensure that they don't get an infection from it, and they might need to get some stitches or something like that, then the cost of going to the doctor that the person has to pay, that is a direct cost. I'm not talking about Medicare or private health insurance or anything. We're talking about the over-the-counter paying of that. If you need to purchase Panadol or medications, then the cost that it takes you to be able to purchase that is a direct cost. However, we also have direct costs for the community. So fees associated with therapy, fees associated with treatments, etc., they are direct costs to the individual. The stuff that is being paid by Medicare is a cost to the community. Okay, the costs associated with the promotion of Beyond Blue and the costs that are associated with purchasing of the steri strips and the injection and the stitches, they are costs to the community to be able to have that care. Now, when we look at indirect costs, we're talking about things that aren't directly related to the disease or the injury that has taken place, but do cost money for both the individual and for the community. So an example is somebody who works on a production line in a factory and they break their arm. Now, they're going and they're paying for the surgery and the cast and all those sorts of things. But the indirect cost is the fact that they can't be at the factory and working anymore. And so if the factory breaks down and it can't be repaired until that person is back at work, then that is an indirect cost for that company, that they are making less product while that person is away. So if a young person is unwell, for example, and they need regular treatment, the transport costs of going to and from their appointments is an indirect cost. And then an indirect cost to the community is family members who require welfare payments because they are taking care of a young person who is unable to go to work, go to school, for example, and that costs the community. Now, the final one is what we call intangible costs, and this is essentially not related to money. So it's the things that are costing us as individuals in the community, but you can't put a money value on it. So it's the pain, it's the suffering, it's the stress, it's the lowering of self-esteem, it's that feeling of worthlessness. Okay, so depression and the mental health side of things means that people might not participate in different activities. And so the intangible cost to the individual is how they're feeling about the exclusion of not participating. It's about them not feeling worthy of participating. And it's not to do with them paying bills to a doctor or people having to take time off work to look after them. It is about the how they're feeling and their place. Now, the community, if somebody commits some self-harm or potentially even suicide, then family and friends will experience grief. And that is a cost because grief takes time, and the process of healing takes time. And so therefore, that is something that we can't put a money value on, but it's how somebody is feeling and it affects them. So it is a cost to their life to have that process of grief. Now, I really hope that Mr. Tyler and I have covered everything. I strongly believe that we have. When we look at the SAC that's been created and the exam that's been created, I think you should be ready to go. But we are more than happy to continue working on helping you answer questions and earn marks between now and the exam and the SAC.